Hello, my name is James Sellers, and I'm here to propose a legislative initiative aimed at improving patient care and safety in Kansas healthcare facilities through the implementation of standardized trauma-informed care, or TIC, training. Trauma-informed care is a framework that recognizes the widespread impact of trauma and aims to create a healthcare environment that promotes healing, dignity, and trust. Unfortunately, despite the evidence showing how essential TIC is to quality care, Kansas has no requirement or standard for trauma-informed training across healthcare systems. This proposal calls for a mandatory, evidence-based TIC training for clinical staff in all licensed Kansas healthcare settings. Our goal is simple: to improve patient outcomes, reduce re-traumatization, and support a culture of safety not just for the patients, but also for the healthcare professionals who care for them. My proposal centers on an issue that directly impacts patient outcomes, staff well-being, and the broader goal of healthcare equity. Trauma-informed care, or TIC. Although TIC is widely recognized at the national level as a critical framework for improving healthcare delivery, Kansas currently lacks a standardized policy requiring trauma-informed training for healthcare providers across all settings. This creates a significant gap in how we address and respond to patients' psychological and emotional safety. Trauma-informed care is more than just some clinical buzzword. It's a comprehensive approach that involves understanding, recognizing, and responding to the effects of trauma. It may be physical, emotional, psychological, or systematic. It emphasizes a culture of safety, trust, empowerment, and collaboration, not only for patients but for healthcare workers too, who may themselves be at risk for burnout or have secondary trauma themselves. The Substance Abuse and Mental Health Services Administration outlines 6 key principles in a study from 2014 of trauma-informed care. It includes safety, trustworthiness, peer support, and cultural responsiveness. Their research shows that without these principles integrated into our systems, patients are more likely to experience re-traumatization, avoid care, or disengage from treatment altogether, especially in marginalized or historically underserved communities. The absence of mandated trauma-informed training in Kansas results in inconsistent care delivery and missed opportunities to build trust and improve outcomes. It also places healthcare workers at a disadvantage by not equipping them with the tools to recognize trauma-related behaviors or respond with empathy and appropriate support. That's why this proposal to standardize trauma-informed care education across the state for all healthcare workers and settings is not just important, it's urgent. It'll lay the groundwork for a safer, more compassionate, and more equitable healthcare environments for everyone. Let's talk about why this proposal is necessary. According to the Centers for Disease and Control Prevention, about 61% of adults in the United States report experiencing at least one adverse or traumatic event in their lifetime. But trauma doesn't just stem from abuse or neglect. It can result from a wide range of experiences, including serious medical events, accidents, sudden loss, systemic racism, or community violence even. In healthcare settings, particularly fast-paced environments like emergency rooms or critical care units, these traumas can be unintentionally triggering or exacerbate by loud noises, rush procedures, or a lack of empathetic communication. When providers are not trained in trauma-informed care, patients may feel unsafe, dismissed, or even re-traumatized by their interactions within the healthcare system. This risk is especially high among vulnerable populations, including children, the elderly, veterans, and those with chronic health conditions or a history of substance use or mental illness. Research from the Substance Abuse and Mental Health Services Administration in 2014 emphasizes that trauma-informed approaches are not only more humane, but also more effective. Their findings show that TIC improves patient engagement, reduces emergency room visits, enhances treatment adherence, and fosters a more trusting provider-patient relationship. This approach supports both patient outcomes and provider well-being by decreasing burnout and moral distress among staff. Yet, despite these benefits, most of Kansas healthcare systems, particularly in adult medical surgical or ICU and general outpatient settings, do not have routine or required trauma-informed care training. It is often limited to behavioral health or pediatric services. This leaves a significant gap in the care delivery and puts both patients and healthcare workers at risk. By standardizing TIC education and implementation across the state can help fill this gap by embedding safety, respect, and empowerment into everyday patient interaction. This proposal is about making trauma-informed care the standard, not the exception. To successfully implement this proposal, we will need collaboration from several key stakeholders. First, the Kansas Hospital Association, which supports healthcare facilities, can help disseminate training initiatives and implementation of support. Their advocacy can also ease concerns about workflow disruption. The Kansas Nurse Association is also vital to achieving buy-in from frontline nursing staff. Nurses are the largest part of the healthcare workforce and are critical to applying TIC principles. The Kansas Department for Aging and Disability Services would also be an essential partner. TIC aligns with their mission to improve the quality of care and protect vulnerable populations. Their endorsement would validate the importance of this initiative from a policy standpoint. Every proposal faces resistance. Hospital administrators may worry about the cost and the logistics of training, especially smaller or more rural hospitals that are already stretched thin. Some private insurers might express concern about whether TIC Implementation would increase documentation or claim to be too complex. To address these concerns, we propose a phased rollout that starts with pilot programs in diverse facility types. This allows us to gather localized evidence and prove the model's effectiveness. We'll also show data from other states demonstrating that TIC reduces readmissions, improves provider satisfaction, and decreases liability risk. Offering continuing education credit and leveraging existing training platforms will also minimize cost as well as the burden. We would introduce this proposal in the Kansas House of Representatives. The House has a strong track record of passing legislation focused on patient safety, workforce development, and healthcare innovation. It also offers greater opportunity to collaborate with a wide network of constituents and committee members familiar with health and human services. In addition, healthcare workforce bills often originate in the House, making it the natural place to kind of build momentum for this kind of proposal. The most appropriate committee to review this proposal would be the House Committee on Health and Human Services. This committee handles legislation related to healthcare delivery, public health, and professional licensing. Given the committee's familiarity with workforce issues and patient care models, they're probably in the best position to evaluate the merits of trauma-informed care training and recommend the proposal for further debate and approval. To advocate for this proposal, I'd take a two-pronged approach. First, we would set up an in-person meeting with lawmakers, especially those representing districts with hospitals that could benefit from early adoption of TIC. Testimony at committee hearings will be backed by nurses, physicians, and patients who can speak to the importance of compassionate, informed care. Second, we'd partner with advocacy organizations. Kansas Action for Children supports trauma-informed systems and has a strong policy experience. NAMI, Kansas, focuses on mental health equity and already closely with state agencies. Their combined support would bring strong advocacy voices and help mobilize the deep-rooted efforts of TIC across Kansas. Gaining media support is probably pretty crucial to creating public awareness and legislative urgency. First, we could write guest columns and op-eds in Kansas newspapers. Papers like the Topeka Capital Journal, the Wichita Eagle, or the Kansas City Star. They could feature real stories from nurses and patients. Of course, we would mind HIPAA. And these narratives would make the issues relatable. Second, we could use social media to highlight testimonials and share data visuals that demonstrate the success of TIC models in other states. A short video campaign spotlighting patient transformation stories and provider experiences could also help generate attention. You can always engage in local news stations with different media ideas and press-related press releases when it's appropriate because of other legislative events or things going on in the community. This is a list of references. Thank you for your time.